Hey, you gotta listen, because I've got something to say. We've had enough of your hate and your disrespect, and we're gonna send you away. Hey, 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 sister, look what they've done. We're on fire and we're ready to run. We've got the passion, we've got the heat, we've got the power beneath our feet. Look at me, can't you see? This body is mine. I make my choice every time. Can't steal our freedom, can't steal our hope. So watch us now, we're gonna vote. Hear our voice. Ooh, we'll fight for choice. Ooh, hear our voice. Ooh, we'll fight. Hey, hey, hey. Look at me, look at us, look at Roe v. Wade. How dare you take it away? Keep abortion safe or we'll send you away. We're gonna vote, hear what we say. Ooh, hear our voice. Ooh, we'll fight for choice. Ooh, hear what we say. Ooh, we'll fight. Hey, hey, hey.
Hey sister, see what they've done. We're your brothers and we're ready to run. Sisters, mothers, and daughters too. We got the power. We stand with you.
Look at me, look at us. Why do you hate? We're gonna vote in every state. We are smart, we are strong, and we know our fate. So shame on you. We'll keep this country great. Say it loud. Ooh, we'll say it proud. Ooh, hear our voice. We'll fight for choice. Hey, hey, hey. Hey, sister, look what they've done. We're on fire and we're ready to run. We've got the passion, we've got the heat, we've got the power beneath our feet. Hey, sister, look what they've done. We're on fire and we're ready to run. We've got the passion, we've got the heat.
So watch us now.
We've just begun.
So watch us now.
We've just begun.
Very powerful video, and to our 90 plus people virtually, I apologize that you got to watch, but you didn't get to hear. So we will fix that for the future, and we'll make sure that we get a copy out to every single person that took time to be here today. It's a powerful video. Feel free to use it. Lynne has said it's there to get this important message out, and I apologize to the virtual audience that you could see but you couldn't hear. But powerful. So I'm going to explain the introduction process to you, and then we will introduce our keynote speaker. So today we have two presenters, and the introducers are both leaders within Floridians for Democracy. Introducing our keynote speaker, Dr. Kate Arnold, will be Caitlin Telgren, who is the co-president of our action-oriented 501c4, and she will introduce Dr. Arnold. And then following Dr. Arnold, we will have Dr. Tim Diegel, who will react and respond to some of Dr. Arnold's comments. Tim has written some really powerful guest editorials, is also a physician. And then following that, we will do Q&A. So for individuals that are on virtual, there's a Q&A button where you can type in your questions. And for those of you who are live, we want you to wait to get a microphone before you actually ask your question, so we don't have to repeat the question. But we've got a couple of mics and we'll be taking them around. So with that, it's my honor to introduce to you Caitlin Telgren, who will make the first introduction. And then following Kate's comments, Jeff will come up and introduce our next person.
Thank you, Jim. Thank you, everybody, for being here today. I just want to introduce Dr. Kate Arnold. Dr. Kate Arnold is a OBGYN. She trained in Oklahoma, but recently had to move with her family to Washington, D.C. due to the political interference in the practice of medicine. Dr. Arnold has worked in a wide array of medical settings and is still practicing today. She also has her MBA, works in many startup companies, and is heavily involved in the American College of Obstetricians and Gynecologists. Having lived in both red and blue states, Kate understands that nowhere is perfect and there are good people everywhere. Dr. Arnold is passionate about protecting women's rights, eliminating health disparities, and striving towards a world where everyone is equal. Please help me in welcoming Dr. Kate Arnold.
My name's Kate Arnold. Thank you for the introduction, and thank you so much for having me. Getting to chat with some of you ahead of time here in person. I've loved getting to hear all that you're doing here in Florida. And thank you to those of you who are joining virtually. It's an honor to have you as well. Before we get started, I do want to acknowledge that this title, Women's Rights in the Red State Brain Drain, which is a little bit of a tongue twister, actually comes from an article that Tim Noah wrote. He's a journalist who has written books and writes for the New Republic, and my wife and I were lucky enough to be interviewed by him. He also interviewed other professionals, many teachers who, like me, left red states due to professional issues with where they were living. So he came up with the title. It's a great title, and I did want to acknowledge him. Next, I really truly just want to thank all of you and thank Floridians for Democracy for having me. You all are an amazing group. I really believe in the work that you're doing, and so I hope that sharing my experience can be helpful for you all, and I thank you all for staying engaged, because that is truly what we need. I know the slides are a little bit difficult to see, so don't worry about them too much. There are some kind of later on that are a little bit more text heavy where it may be helpful, but mostly for the first half at least, it's pretty pictures. So you can look at them, but I know they're a little bit out of place. So a little bit about me. I am an OBGYN. I do have my MBA, but I wanted to kind of explain my trajectory a little bit, not hopefully because I have the physician God complex, but because I've learned from people along the way, and I want to be sure I'm sharing what they've taught me. So I grew up in Palo Alto, California, which is where Stanford is. It's an incredibly privileged place to grow up. It's a little bit like Pleasantville. I truly was lucky to grow up there. I don't know if it's because of where I grew up, but I am incredibly gullible still. I looked up gullible in the dictionary because people told me it wasn't there. I fall for like gullibles on the ceiling. Incredibly gullible. So growing up, I 100% believed everything I got told, and it was a great place to grow up. I believed that, anyone could be anything if they worked hard enough. I believed that I truly remember seeing like pictures of people working in factories or coal mines and thinking like, that is so cool that everybody gets to have the job they want where they just use their brains and whatever they're good at, they go do that. Nobody has to do menial labor, a job that they don't like. And I truly remember thinking that. So it was a pretty crazy, but also wonderful way to grow up. For those of you who aren't familiar with the area, right next to Palo Alto is a place called East Palo Alto. And East Palo Alto, despite its name, is actually a totally different county. From a historical perspective, it's actually very interesting. So Stanford University was established by the Stanfords, and they made a law that there could be no establishments selling alcohol, no liquor stores, within 1.5 miles of Stanford University. And so 1.5 miles away in East Palo Alto, a place called Whiskey Gulch popped up. And it was just full of liquor stores, and it was where all the college kids went when they wanted to not follow the rules. And it is a community that is systemically faces every barrier you can imagine. When I was growing up in the 90s there, it was actually dubbed the murder capital of the country because there was 46 murders in a community of about 23,000. I lived 3 blocks away from that border. It was just a creek. And so, I grew up in this incredibly privileged Stanford community, and then the murder capital of the country is 3 blocks away. So when I was in elementary school, my mom said that she would give a kid in my class a ride home. And there was some busing that happened. And so, it made sense. This kid lives like 4 blocks away. It happens to be in East Palo Alto. And so my mom would give this kid a ride home from school. And I remember going into this multi-generational apartment filled with like so many people. And there was so much noise, and there was juice and LEPS supervision, and just realizing like this is a whole nother world that I did not know about. It was so different. And for whatever reason, I was kind of drawn to East Palo Alto. It became a big part of my life. When I was in college, I ended up volunteering there, and this woman named Lisa Moody, it's not working. This woman named Lisa Moody, who is a community pillar in East Palo Alto, took me under her wing. And, everyone would hear that I was in East Palo Alto and say, that's a dangerous place. What are you doing? And she taught me that the dangerous people make up about 10% of the people, and the rest of them are working really, really hard and are good people. And so I loved my time there. I'm so grateful that this community leader took me under her wing. And eventually I just kept volunteering there more. I lived there in college, and it was a big part of my growing up. So the big question to me was, I would get told East Palo Alto is too dangerous, you shouldn't go there. And then I would look around and see little kids running around everywhere. And it really sparked the big question in my life: how come it's too dangerous for me, but it's okay for these kids? That didn't make a lot of sense. And to me, it still brings up a lot of these issues of what's good enough for some people versus other people. When we look at the definition of democracy, we can see that it includes that there's a sense of equality among the participants at an essential stage of the government process. And if we think about that, then even back in the 90s, we weren't really living that. So again, I think we believe in equality, but we also believe that in some ways schools, food, doctors in certain communities are acceptable for some people and not acceptable for other people. In my mind, it was never equal, but at least before Trump and before MAGA, I think there were more people on board with, but we want it to be. We want it to be equal. Never was, but at least I think we wanted it to be. I think a lot has changed in terms of politics. Obviously, you all in Florida have felt it here a lot, as we did in Oklahoma. This is a picture of my grandfather. He was from Oklahoma and practiced law in California, staunch Republican. My cousin grew up as a very passionate left Democrat and was also an attorney. And so they would, constantly clash over politics, but civilly. And then they both lived in LA, and my cousin started talking about the LA riots after Rodney King was killed and the police officers who killed him were declared innocent. And so she was down with a nonprofit she was volunteering with, trying to document police brutality. The thing that I love is that my grandpa heard about this as a staunch Republican and went down to the LA riots to see what was happening. And the part that stands out to me about that is that, yes, he was a Republican, but he still had that belief of people shouldn't be treated like that, and I want to see what's happening, and he was there to bear witness if people were being treated poorly. And he came home and said, they are, like, this isn't right. And to me, I love that they were able to have those shared values. I think now in the Republican Party, I don't think you would find that quite as much. I think there would be a lot of blaming about who's out there and what's happening and, you know, all the terrible things that people would say about the people out there rioting. So I think that's something we've lost. Again, don't worry too much about what's written. To me, what's happened over the last 30 years, but particularly in the last 10 years, Republicans have embraced this authoritarianism, this nationalism that typically we see with fascism. And it's this belief that one group is better than all the others, that one group is entitled to things that other people are not entitled to. And when we get to that point, often you have to, if you're going to be an authoritarianism, you have to believe and pick the populations that don't deserve what you deserve, right? And so we've started seeing that. And so people who are pregnant don't deserve the same things that other people do. Racial minorities, LGBTQ population, particularly trans people, rural people, and ironically, I felt in Oklahoma, sometimes people in red states don't deserve the same things that other people do. So that's where I think we are right now. But before we keep going, I want to go back a little bit and tell you about how I ended up here, starting with 2013. So as I was volunteering in East Palo Alto, I became close with one family. The mom had gone to the same middle school I had. She was from East Palo Alto. She'd gone to the same middle school I had, 1 year below me. I didn't know her, but I was volunteering at this home for teen moms when she moved in. And she moved in with her one son, and we just clicked. She was at a really vulnerable point. She was trying to get clean from drugs. She was there with her son, and strangely, she was most upset that there was a cat there. She was just terrified of the cat, and so probably through her being so scared, we were able to form a bond. And that was, I think, in like 2003. And so we formed a bond. I, really commiserated with what she was going through as a single mom. She had 2 kids then. She stayed clean, worked. She had a 3rd kid. We stayed really close. I would watch the kids usually about 1 weekend a month to give her a break as a single mom. And then I came to medical school in Washington, D.C. And while I was gone, I don't think because I was gone, I hope not because I was gone, things took a turn for her, and she relapsed. And so in my 3rd year of medical school, I got called that the kids were in foster care and that she had named me as the person to take the kids. So parental rights were terminated. I talked to Georgetown, where I was in medical school, and said, I need to get these kids. And luckily, Georgetown was very understanding. I mean, there's always a lot of hoops, but they really supported me. They let me move back to California to get the kids in my 4th year of med school, and then I had to figure out how to get into residency with 3 kids. So all of a sudden, on a residency salary, the coasts were not really feasible financially, and so I looked to Oklahoma, where my grandpa was from, where I had extended family, and decided to go to residency in OBGYN at OU. So obviously that's a lot of decisions for a lot of people to grapple with. Some people thought it was great. A lot of people thought I was crazy. A lot of people really worried about how I was going to be a good doctor and a good mom. And when I called my grandparents' old friend and said, I'm a little bit worried about Oklahoma. I now have these mixed race children. Am I going to be okay in Oklahoma? And she, with her, that kind of honesty that some Oklahomans have, she said, oh, sweetie, you're a doctor. It evens out. I was like, okay. And so we moved there, and I cannot even describe how well we were treated. I mean, I'd been a mom for a year. I moved into a house and got there, and several things went very, very wrong. I didn't turn on my heat or electricity or anything, water, nothing. So we drove across, from California to Oklahoma to a house with no heat, no water, I guess it was air conditioning because it was in the summer, but nothing worked. And my neighbors saw our car drive up and then noticed that when it got dark, there were no lights coming on. And so they so kindly just walked across the street, gave us flashlights, said, let us know if you need anything, and were so kind. A day or two later, our moving pod got delivered. I, of course, had not hired movers or anything like that either. And so all of a sudden there's a pod with all this stuff. And all the Oklahomans came out and said, do you need help? And I truly cannot remember anyone in California ever running towards a moving van, You're kind of like, well, that looks terrible. And so that was just incredibly striking. And I loved living in Oklahoma. People were so kind. I mean, they were so kind to my kids. They took them swimming. We integrated right into Oklahoma, despite being a little bit the crazy lady with 3 kids who was in residency. Then, as a OU intern, I fell in love with my chief. I had always dated guys before. I can't really explain it, but I fell in love with my chief. And so luckily it was not the Grey's Anatomy level of drama. Everyone was actually very accepting and supportive, and we got married 2 years later, and then my wife carried our twins. So then we were up to 5 children, which made us even crazier. But Oklahoma was usually okay, There were some times where somebody would say that they had voted against marriage equality and tell me not to take it personally. And that's tough, but on a day-to-day level, people came to our wedding, they treated us like any other normal married couple, and it was a really great place to live. As I moved through my training, I got more and more involved in advocacy work. So I graduated from OU, I stayed there for a little while, and then I moved to a federally qualified health center, which is a healthcare center that takes care of mostly Medicaid and uninsured patients, and very much fed into my passion for advocacy. So in clinic, I would, take care of trans patients, take care of largely Spanish-speaking and African-American population, went home to my wife and my mixed-race children and just tried to advocate. I was able to start our advocacy day in Oklahoma, which this is a picture of that. We would bring 20 to 30 medical students, residents to the Capitol to advocate for issues that impacted women's health. We always had 2 asks, and it went well. I mean, I started the advocacy day. It didn't exist before that. I left right after number 5, and it still happened this year without me, which is wonderful. But as we were doing that, things got more difficult. The chasm started to grow between the legislators and what the American College of OBGYNs was encouraging us to advocate for. The legislators got less and less willing to hear us. And so, whereas before we had a pretty good relationship with the legislators, in 2022 they told us, if you mention abortion, the meeting will end. And so that was tough, and we complied. We went to our advocacy day. We didn't mention abortion. There were other bills that we advocated for and against, and we did not mention abortion because we felt like it was worth having those meetings. It was worth having those relationships. In 2023, it got worse, and that was really, really hard because I think a lot of us felt like we had kind of missed the boat in terms of advocating for abortion, and it escalated. So in 2023, they told us if you mention trans health care, you'll just be escorted from the building. So not that meeting's over, your whole day is over. And so that was incredibly difficult, but again, we complied. And meanwhile, ACOG, that 10 years ago had been their PAC, their Political Action Committee, they publicized all the time that they donated equally to Republicans and Democrats. It was like 49-51, something like that. Well, ACOG hadn't been able to do that anymore. Fighting for women's health become more and more of an issue where they could only support Democrats. And they started really touting abortion as essential health care, which I believe, and also made things difficult in Oklahoma, and I imagine makes things somewhat difficult in Florida. So this chasm just continued to grow. Things got worse. Oklahoma continued to be a worse and a worse place for women. In 2023, it was actually named the worst state for women, and it's partly because of things like this. This was a woman named Brittany Pula, who was, I think she was 20 or 22 years old, and she was using drugs, and she miscarried, and she actually got tried and convicted of manslaughter. She miscarried at, I think, 20 weeks, so the baby was pre-viable. There's nothing anybody could have done to save that baby, and we don't know that drug use caused anything that happened. She actually got sentenced to jail time, to 4 years of jail time for miscarriage. So at this point, us as OBGYNs can look at the evidence. I mean, there's so much evidence going back and back about people trying to criminalize drug use in pregnancy. And every time we try it, it's a terrible idea. We see women not coming in from prenatal care. We see worse outcomes for moms and for babies. And there's documented trials of this over and over again where you see worse outcomes. So this did not feel like even an emotional plea. This was just, hey, science is against you. This is going to lead to worse outcomes. So I helped to write this letter with a bunch of other OBGYNs. I signed it, and I was reported to my employer. They wrote in. I was a leader. I was a women's health director at the Federally Qualified Health Center, and they wrote in and said that they were concerned that a leader in the organization would be for women who are drug addicts raising children or being moms, which, you know, my kids are literally drug exposed, and so the concept that I wouldn't care about that was pretty appalling to me. But it was the start of me realizing that it was getting harder and harder and harder to speak out, and that was really scary for me. Next came Uvalde and Dobbs. And there was actually a third incident that I forgot to put up here, but we'll talk about it. But my twins were about to start kindergarten when Uvalde happened. My older kids were obviously in school, but they were about to start kindergarten. At the same time, I was getting calls to speak out more. The Dobbs opinion was leaked, and I was the chair of Oklahoma OBGYNs. And so everybody's calling saying, can you comment? Can you comment? And then there's violence, and there was actually, the third incident was that the only black orthopedic surgeon that we had, or orthopedic doctor that we had in Oklahoma was killed by a man who had purchased the gun like less than 2 hours before that. And he came into the office and killed the orthopedic surgeon and 2 other providers and I think 2 staff members. So these 3 things kind of collided. Everyone wanted me to speak out. My job did not want me to speak out. I was worried about the school shootings. I was worried I could be targeted for anything, for LGBTQ issues, for protecting women's rights. And so I really wanted to speak out, but really did not feel safe to do so. So we moved. Tim Noah, as I mentioned in the article, did a great job of capturing it, but literally what happened was all those things happened. The Tulsa shooting happened and the Dobbs decision being leaked while we were on vacation. And I kind of jokingly tell my wife that I was just the worst date ever because I went out and was just like, this isn't working. Like, I can't live here if I can't speak out, and I can't speak out because I don't want to put anybody in danger. So we decided to move. I went to medical school in DC, and so we decided to move back there. We are settled. Those are my kids up there on the left about a year ago when we first moved. Jesse's on the far left. He is 20 and he lives in Utah right now. And then Isaac in the middle, he's 21. He's in the Army right now. He just got back from Syria being deployed. And then Lexi on the right is my 18-year-old who this impacted the worst because she was a senior. She just finished her senior year of high school. So I made her move for her senior year of high school. So she doesn't love that. And then our twins are in first grade right now. Moving has made me feel safe, but I still miss lots of parts of Oklahoma. I think, unfortunately, people have this conception that, oh, you escaped a red state, congratulations. And I get a lot of that kind of like coastal elite attitude that like, oh, you were in California and then you kind of like went to a worse place to live like Oklahoma and now you're finally back to a blue state. But there are lots of things about Oklahoma that we still miss. So I want to switch gears a little bit and talk about my experience with abortion pre-Dobbs and how that's kind of changed. So in medical school at Georgetown, I went to one day of an abortion clinic, and I was already pro-choice, but it wasn't something I was really passionate about. I didn't, to my knowledge, know anybody who had had an abortion, and going to this one day of an abortion clinic was one of the best things that could have happened to me. The people that I saw there for abortions were normal women. One was, I still remember, about to start nursing school, found out she was pregnant and was like, I need to go to nursing school. I can't do this. The other woman was in her 30s, and she had a really great group of friends. They were all single. She didn't want to be pregnant. She didn't want to have a baby. She wanted to continue working hard and being single and having that kind of single life where you're not dealing with children. So that was a great experience for me. In residency, we officially didn't get training on it. We officially didn't do abortions, except that we did. I think when we think about abortion, we think about an abortion clinic and patients seeking out an abortion. The abortions that we did were things like somebody who comes in at 20 weeks and their water's broken and the baby can't survive outside of the womb, and yet we know the mom's going to get sick, and so we induce them. And that is an abortion. That's also a terrible day for a woman. I mean, this is a desired pregnancy, a desired baby, and they're going to have to deliver this baby, and I can't do anything to save the baby. So we never told those women, you're actually accessing abortion care. And I still question that decision because I would never want to make that day harder for a woman. I also hate it that women who needed that service don't realize that they may have voted to take that service away from other women. And so I don't know what the right answer is there. We sometimes terminated for lethal anomalies. I remember very vividly having a woman who was 42, I think. It was her first pregnancy. She had never been able to get pregnant before, and her baby had a terrible anomaly that was just completely incompatible with life, and I was able to induce her before she was viable because she got sick. We were able to call abortion clinics and coordinate with them. My attendings, and then me later, once I was able to, would sometimes call Planned Parenthood and be able to pay for the abortion over the phone, arrange the appointment, and we were able to discuss all options with patients. And I think we didn't realize that it could get worse. I think pre-Dobbs, everybody kind of thought like, well, we're not allowed to do abortions as a state employee. We're not allowed to do them. They're all part of this abortion clinic. There were like 2 abortion clinic options in Oklahoma. They were safe, they were good, and everything was just kind of segmented. And we thought, well, it can't get worse. This isn't something that we really need to advocate for. Obviously, that was wrong. In September 2021, when Texas passed Senate Bill 8, I remember being on all these legislative advocacy calls, and it sounds strange to say it now, but everybody was kind of mad at Texas. It was like we were talking to the Texas leaders, like, how could you let this happen in your state? I know it sounds ridiculous, doesn't it? But in 2021, for whatever reason, it felt like this came out of nowhere to some of us. And it felt like, Texas, you're crazy. Like, what are you doing down there? And I remember the leader in Texas getting on the phone call with us, and I thought that he would kind of have the same attitude of like, man, like my state, what is happening? And he told all of us point blank, he said, I don't need your anger, I need your help. This is gonna spread everywhere. And he I still have that in my mind. That was not a concept to me at that point. And after that phone call, obviously things continued to get worse for access, but I think we still need to remember that nobody needs our anger. Everybody needs our help as these things happen. Post-Dobbs in Oklahoma, things got really tough. I could no longer legally counsel patients. So there was a law in Oklahoma after Dobbs was overturned, their trigger law said that we could not aid or abet patients to get abortions. So I was still at the federally qualified health center. I had 12 employees under me, nurse practitioners and physicians. And so I was the one who had to email them and say, you can't tell these patients how to get help. You can't tell them where to go get an abortion. Every lawyer at every hospital interpreted it differently. Our attorney interpreted it as we could counsel them about what the medical procedure was or what the surgery was, but we couldn't give them any way to find those resources. So I couldn't, everybody had all these great ideas for, financial help with transportation and help with where to go and all this, and I couldn't tell them anything. So I would get these calls. There's a 16-year-old rape victim in my clinic right now. Are you sure I can't tell her? And I would have to say, I'm sorry, you can't tell her. And it just kept going, a 30-year-old with one child who had severe housing insecurity. She knew if she had a newborn, there's no way she could couch surf with 2 kids. A 40-year-old with a high-stress job who had severe nausea and vomiting to the point that she couldn't do her job. And a 45-year-old with concerns for a lethal fetal anomaly. So I couldn't talk to these people. There was lots of fears about being recorded. We are a state in Oklahoma where you only need the consent of one person to be recorded, so that's the person with the tape recorder. So, some people would say, well, just have the conversation, don't document it, but somebody can always have a recorder in their bag. There were fears of violence. My job actually clarified that they had not wanted me speaking out about these issues because the FBI had been in touch with them that we already had threats of violence against our clinics just for providing contraception. So obviously if I became like a lightning rod for abortion, that would get worse. And I didn't want to put the 18-year-old sitting at the front desk in danger. I mean, that seemed terrible as well. The other thing to clarify is that OBGYNs are so used to being sued. I mean, you graduate from, or you choose it as a profession and everybody just says, you're gonna get sued, it'll happen. It happens to everybody. But these are not malpractice issues, these are criminal issues. So all of a sudden, the lawyers that we are used to calling, like if something goes wrong on my shift, I'm used to calling a lawyer and saying like, just so you know, this is what happened, like, do I need to document anything differently, all that kind of stuff. And this is different. These are not the right lawyers to help you with that. And it's not the hospital's liability, it's my liability. It's me going to jail, it's me paying fines, not the hospital. So the hospital couldn't really help us anymore. And some people would say, well, we just need a test case, which is so scary, right? You just are supposed to be the test case as the doctor who says like, hey, 16-year-old, here's how you get there. I'll arrange, all of this with all the resources I have, and then invite that attack and just see how it plays out in the courts. Well, meanwhile, that's just really scary from a violent standpoint and from do you ever get your medical license back? Do you get to practice again? There were stories of nurses. I know some nurses just would drop business cards and hope that would work, that somebody would pick up the business card that said like what to Google and maybe that would work. But it was a really scary time. Abortion education is something that I hear a lot of people concerned about. I do think it's a concern in red states and in states with restrictive abortion laws. I think there's kind of 2 options. One is that we can claim that handling a miscarriage is the same as handling an abortion, which it is technically in terms of like medication management and surgical management. It's not the same in terms of counseling, which is what we'll talk about. The second part is that you can be creative and hope that you can get your residents somewhere where they can get trained out of the state. I tried that at OU, and there are so many barriers. We tried getting our residents to go to Kansas to get trained. Well, first they say, you still can't do abortions while you're receiving any kind of state compensation. So that means that you would have to be on vacation time, you would have to have your own malpractice, and you can't actually, they said to the point that they couldn't pay your healthcare premiums for that amount of time. So you go for a month and you have to forego all your benefits, all your salary, all your malpractice, and so it was something that we could never get done. In terms of the ability to counsel, I think that is the part that you just can't get from counseling people about miscarriages, obviously. When you are talking to somebody who's pregnant, if you haven't had any training in abortion care, it's so easy to walk in and be like, hey, you're pregnant, congratulations. And then how is that person supposed to say, like, actually, I'm not sure I want to be pregnant. What are the other options? And so there's great training out there. Sometimes you can do those kind of virtual trainings or those kind of practice counseling situations, but being able to watch somebody more experienced than you do that counseling and being able to practice it with patients while you're getting feedback is really what you need. It's incredibly complex training because ideally what you want to do is be able to walk into a room with a woman with a positive pregnancy test and have her feel supported no matter what her choice is. So I have to make sure that the words that I say make it okay for her to say, I'm so excited about this baby. Or for her to say, there's no way I can have a baby right now. Or for her to say, I don't know what I'm gonna do. And it takes a lot of training to be able to do that. And I think that is truly what's going to be missing from residency education in states that have prohibitive abortion laws. So what about Florida? We'll make this hit a little bit closer to home. And I am aware that largely a lot of this is preaching to the choir, and this part in particular, because you're all here, which is wonderful. But at this point, you all have your 15-week ban in place. It's about to go to 6 weeks. From a healthcare perspective, that is just a huge, huge difference. I actually looked up the numbers. So at 15 weeks, you all are able to perform 95% of needed abortions. 95% of abortions happen below 15 weeks. When it goes to 6 weeks, you'll be down to 34% of abortions, meaning that 60% of people needing abortions will not be able to get abortions here. 6 weeks, as most of you know, is a time when many women haven't quite figured out that they're pregnant. They haven't even missed a period yet, and so you have to have somebody with a regular period who's really paying attention to know that they're pregnant. The good news is that you all have your state initiative on the ballot, which is huge. In Oklahoma, I've been part of discussions to try to do this, and it is so hard. So congratulations to you all for getting it on the ballot. That is huge. So truly, congratulations. And now, as Jim said about everything, it's time to go make it happen. In Oklahoma, I know one of our big hesitations about putting it on the ballot has been it's a big deal if it fails. And so I cannot stress how important it is, and I really just congratulate you all because that is a big deal. So congratulations, keep working hard. I was so inspired by everything I saw happening in the lobby, so I applaud you all. I wanted to go over a little bit about what this is doing to OBGYNs. I know we talked about kind of what I experienced, but this is a study that just came out in this year, I think in January of this year, looking at OBGYNs' perceived impacts of post-obs in state abortion bans. And I actually participated in this questionnaire that they did. It was a semi-structured questionnaire that they did, all of OBGYNs in red states. And they were able to pull out a couple themes. One was on the clinical impact, and one was on the personal impact. This is small writing, so I'm just going to talk about it. But the first, there were 3 clinical impacts that physicians felt. One was in delay of care. So many of the states, Tennessee being the exception, have the clause that if the maternal life is in danger, you can intervene. I think that may have sounded good to a legislator. As a physician, I have no clue what that means. And every physician in this study was able to articulate the same thing, like, how likely does death have to be? I mean, to me, like, a 10% risk of death is not normal at all, and I should intervene. But from a law perspective, is it 50%? Do I have to document labs are not looking good? Can it be a clinical picture? And so many physicians have felt that pull of potentially having to wait until patients get sicker. One of the quotes was, is 5% risk of death enough? Does it take 20%? Does it take 50%? What's enough legally? And the legal people seem to have different definition every time you talk to them. It feels terrible to tell a patient that you have to wait until they're sicker in order to be able to intervene. The second clinical impact was on counseling restrictions. And I talked about that, but another physician said it feels like you have, even if you feel like a patient who you think is pro-choice, you shouldn't contribute to conversations because you just don't know if you're being recorded and if that could be used against you. And lastly, they talked about the inability to provide care. It's very difficult when you as a physician know what needs to be done and you can't do it. You know what that patient needs, you know the procedure they need, and you know how to do it, and you can't do it. So those were some of the clinical impacts that physicians had articulated in this study. In terms of personal impacts, people talked about moral distress. Moral distress is feeling like your actions are not able to align with how you truly feel. One of the quotes was, moral injury is getting thrown around a lot, but this is what it really is. I know the right thing to do for my patients, but I'm carrying the legal worry and worried about what could happen to my family at the same time. It's a terrible thing to feel. The second issue people brought up was perceived consequences of violating the state law. They said, I feel like there's a politician in the room with me and my patients just waiting to send me to jail, to make an example of me and say I did the wrong thing. The next one said, it used to be that any day you were going to work, you could get sued. And now, any day you go to work, you could get sued or you could be charged with a felony. And that additional anxiety just weighs on me. People talked about leaving the states. 10% had actually left their states. And lastly, there was a cost of mental health. They said when Roe was overturned, there was just this cloud that came over me and has not left. And there's a constant unease, a feeling of just being uneasy. So obviously I identify with a lot of those things, but I think it's somewhat nice hearing that those are being felt throughout the country. Of the people who couldn't move, many of them did say they had personal ties and that it was still incredibly difficult to be there, but that they had no plans to leave. Leaving is a really tough decision. These two maps, which are small, but they are maps of where abortion restrictions are, and then also of maternal care deserts. So on the right, the more blotchy one, is maternal health care deserts, and on the left is states with abortion restrictions. Patients are being hurt directly by not being able to access abortion care. That's part of it. But as physicians like me, and I do feel the burden of this, as physicians like me move out of these states with abortion restrictions, we're going to worsen those maternal health care deserts. A health care desert, to back up, is an area where there's no access to OBGYN care. So the map on the right of maternal health care deserts is from 2020, so from before any of this started happening. And now, physicians leaving is worsening that. And the important part about that to note is that we're not just limiting access to abortion care, we're now limiting access to all care because there just aren't enough physicians in these areas. Sometimes I hear and can feel abortion's out, but now it's done, right? And I think you all know, but this is obviously a symptom of a much bigger issue, to go back to kind of the start of the talk of equality and of things being other and unequal care. So there was a bill proposed this session in Oklahoma that was going to outlaw anything that could be used for abortion, which includes all kinds of contraception. Trans care, when I was at OU, they recruited someone from out of state to come take care of trans kids. Mostly that involves doing puberty blockers so that these kids can stay kind of in that androgynous prepubertal form while they undergo therapy and try to figure things out. So they recruited her when I was in residency. So that was in like 2015, they probably recruited her. She left the same time I did because there was a terrible deal that happened where the Oklahoma legislature said that they would give OU money to build their children's psychiatric hospital, but they would have to stop doing all trans care. And OU took the deal because they knew that there was a bill coming that it would be illegal in the state anyway. So they figured we might as well get a psychiatric hospital out of it. And that deal did come, so it's now illegal to provide transgender care for minors. And gun control is intimately tied to free speech. As I've mentioned, my job needed me to be quiet because we were under threats, and when passionate people have good access to guns, it's just really scary to speak out. So to me, I want to highlight that I think abortion is just a symptom of the extremism that we're seeing everywhere in all facets. I do want to highlight two people who decided to stay where they are because I think that is also a completely valid decision. I chose to leave, a lot of people choose to stay, and I think that is incredibly important. Chloe Akers is a very fascinating person. I look up to her, and she has had just the most interesting trajectory recently. She lives in Tennessee. She's a criminal defense attorney and was defending like people accused of murder. And all of a sudden, these abortion laws made it so that OBGYNs needed criminal attorneys. And she was passionate about women's health, and she became all of a sudden the go-to person for understanding how all these laws were going to impact patients and doctors. So she has actually started this organization, The Best of Tennessee, which is really trying to get out of all these extremist views, and she has just been integral. So she has really doubled down, is staying in Tennessee, and really fighting for Tennessee to become less extremist, which I very much admire. And this is one of my good friends. Her name is Dr. Allison Gilbert. I met her at OU when she was a med student. I was a resident, and then she went to residency in Alabama, stating that she wanted to pursue family planning as her passion, which we all thought was a little bit crazy because why would you go to Alabama if that's your goal? But she's passionate about the South. She loves the South, and she loves family planning. So that's what she did. She went to residency at UAB. She did her fellowship in family planning, and now she's in Texas. She had been traveling to do abortions, and she has kids now. She can't do that, but she's staying in Texas, and she's able to help with residency education. She's able to be a voice that is different from most of the voices that they hear there. And so this is her, back when Cuomo was a show, speaking out, and she continues to do that. So I really have a lot of respect for her. So in conclusion, in the end, I am very against these severe red state policies, but I loved my time in Oklahoma. I still believe that some of the best people are doing amazing work in red states. I miss a lot of things about Oklahoma. Ultimately, my decision came down to feeling safe, and now I feel safe. The part of the other argument that we've seen, I really believe that this is one of the biggest issues we're facing. I felt it in Oklahoma, and I wanted to speak up, but all these policies were interconnected. So I really applaud all of you being here. I think now is the time to speak up. I think we are definitely at an inflection point. We've had a lot of inflection points, but this is a big one with Trump's election coming up. I think if Trump is elected this time, I don't know if we'll get another chance because our democracy is truly in peril. This is a book by Melinda Gates. It's a wonderful book about reproductive rights and the impact that family planning can have on a society. If you haven't read it yet, I really encourage you to. She literally traveled all around the world, had conversations with women, and she is a very devout Catholic woman who grappled a little bit with her views on reproductive rights and came out believing that they are just at the core of every society. So it's a wonderful book. But her quote is, "Every society says outsiders are the problem, but the outsiders are not the problem. The urge to create outsiders is the problem. Overcoming that urge is our greatest challenge and our greatest promise." So in closing, I hope that rather than being depressed by all of this and putting our heads in the sand, I hope that we can all connect, that we can not berate people who are for Trump, that we can really connect with them to make a change. I hope that we never confuse treating symptoms with treating a disease. This is obviously relevant in medicine, but I think it's also relevant with abortion. I really believe abortion is just a symptom of everything that's happening in the United States, and we're gonna have to address the bigger issues as well. I think we need to find common ground with people. I've talked with a lot of you here who have family and friends who are Trump supporters. I do too, and I don't think that being the Democratic elite is gonna get us anywhere. We need to connect with people, we need to engage with them. We need to be curious and not judgmental about why people are voting the way that they are. And I think that we need to give people room to change views without being humiliated or embarrassed. I think that when someone says that they're questioning it, I never, ever, ever think that we're gonna make the right move by telling them, "I told you so," or "How could you have voted for them?" We need to make a way for them to disavow Trump and MAGA policies without feeling humiliated or embarrassed. And ultimately, I think we need to keep progress as a value, not being right. Again, just staying away from that "I told you so" attitude. So with that, I just want to thank you all. I want to thank all of you who made it possible for me to be here. And I really thank you for your time. I thank you all for the work you're doing. And I'll take any questions after our next speaker. Thank you.
It's my honor to introduce Dr. Tim Diegel. He's trained in internal medicine, ophthalmology, and neuro-ophthalmology. Most of his active clinical practice was in ophthalmology with the Park Nicollet Clinic in Minneapolis. He also served as an Air Force flight surgeon and later went on to serve 20 years in the Air Force Air National Guard, where he retired as a colonel. Presently, Tim is a part-time resident of Naples and is medical director for the Florida Lions Eye Clinic in Bonita Springs. Most significantly for today's program, Tim has become a prolific pro-democracy letter to the editor and guest editorial writer, frequently published in the news press and the Naples Daily News. Following Tim's comments, we'll have a Q&A with Dr. Arnold and Dr. Tim. Microphones will, just raise your hand. We'll come around with microphones so we don't have to repeat the questions. For our virtual attendants, if you use the Q&A on your computer to type in your question. Okay, and it's my honor to have Dr. Tim.
Well, I'm a big believer in the brain drain, but I'm not going to talk about abortion, and I'm going to talk about mainly how the red state policies will affect the future of the health of the states detrimentally. And my big push is how to attract more brains into Florida. From the political changes coming, there's going to be an effect on the 800 to 1,000 people moving into Florida each day, which has been occurring last year. And it's a big inflow. But the way things are going, there's going to be a huge outflow based on the political climate and the policies that are being put in. I recently wrote a commentary in the Naples Daily News when I read the news that the two clinics coming into Southwest Florida, one is the HSS, the Hospital for Special Surgeries. It's an orthopedic organization from New York and mainly Long Island, and there have been billboards around announcing their arrival, stating it's the #1 orthopedic clinic in the country. And this apparently is true because they do so many procedures. And with this organization coming, they're going to need a lot of the best and brightest physicians. The other large clinic is the cardiovascular, the Schultz Cardiovascular and Stroke Clinic coming to downtown Naples, hooked in with the campus of NCH. And they're going to need a lot of the best and brightest physicians coming in to start their reputation. And after I heard these two coming in, I said to myself, how can Florida attract the best and the brightest? And I thought, I don't know if they can. And one reason is that nationally, Florida has been very poor in the national ratings. The Florida Times Union listed as number 41 out of 50 where Florida stands as far as healthcare goes. And in addition to a lot of these statistics that are bad for Florida, the malpractice premiums for doctors is the highest in the country in Florida. And that's because of the huge payouts that the organization, the company, has had to pay. So these two facts can be red flags for any new physician coming into the state. Medical students are pretty much now 50-50 throughout the country, male-female. And these mostly are students in their 20s, and they have no time to be out socializing. It's study, study, study. It's a very arduous experience. So what happens? Well, in these years, they end up getting romantic, and they end up getting married to one another. I had lunch yesterday with a physician who got married from a classmate, and the classmate wanted to go into dermatology, but she thought, well, the two of us have to find a town or city that needs our two specialties. And she thought there are a lot of dermatologists around, and this may limit where we can go. So she switched to family practice, primary care. Everybody in the country needs another primary care. And I had recently spoke to a new young woman physician, and I asked her, what do you think about this? I read that 40% of the students marry each other. And she said, oh, no, it's more like 50%. And this causes the issue because of the two specialties. And depending what each is, it can be quite a conflict as far as being able to find two jobs. Now, for example, if one was trained as a hand surgeon, and there are very few of those around, that's a 1 to 3 year additional training after orthopedic training. So very few around. And if one was a hand surgeon, the HSS facility, more than happy to grab that person. Or a person may be a invasive cardiologist, somebody that does the stents in the hearts. Well, the Schultz clinic would be more than happy to have that person. But if the other spouse happens to be OBGYN or a reproductive endocrinologist or neonatologist, any of these women issues, many of the red states, most of them, will not be too eager to get a person like that. Plus, obviously, the spouse would not want to go to the red states. Oh, so all of a sudden, Florida misses 2 well-trained physicians. And the more red states, the more dramatic that is. So the state of Florida has to overcome a lot of the negatives. And it's going to be hard to do because they keep putting in more policies that are negative. So it's pretty hard to overcome that. The immigrants and the poor are not well taken care of in Florida. And this is an issue for society as a general condition. The legislature in Florida, as you may know, twice turned down over $300 million from the federal government because the legislature would not approve the expanded Medicaid program. And the Medicaid program was to get more people on the rolls for Medicaid. The poor have no insurance at all. And in addition to the Medicaid program for giving insurance, it also is an educational format for the poor people as far as how to take care of yourself if you're diabetic, smoking cessation, and other things. It's sort of a package. So what happens, because of the denial of this program, the poor and the immigrants, they're still getting sick. They're still having accidents. They're still having problems. But right now, they sort of make do with what they can do. Well, what happens is the problem gets worse and worse and drags on to their detriment. Last week, I saw a very poor man who came into the Florida Alliance Eye Clinic, and he's 32 years old. And he said it's been 2 months since he lost vision in his eye. And I think he went to a primary care clinic, probably a free one, and they sent him over to Miami to the Bascom Palmer Eye Hospital. And it took him a while to get there, and he got there, and they weren't able to do anything. He didn't know why. So he ended up seeing me last week, and I diagnosed that he had had a total retinal detachment in that eye, and it's blind, nothing to be done. Now the state of the art for a retinal detachment, the standard care, is that surgery will be done within 1 or 2 days, and usually get pretty close to 100% resolution with it. So that's just an example of how the poor people and they live. I mean, they need insurance. They need insurance. There are over 1,000 nonprofit clinics in Florida. These are the food shelves, neighborhood health clinic, some free clinics, over 1,000. And that's probably the most of any state. And that's because the legislature has never given any money to any social program. This last year's budget is giving some money to the food shelves, and I think there might be a trend toward the positive way there. And there's a great shortage of all types of workers, especially in agriculture. For every 100 openings, there are about 58 workers. And part of that is because there's no plan to give temporary visas to the immigrants coming in, because they want jobs, and our society here in Florida needs more people to do jobs. Restaurants, the whole gamut there, which they refuse to do. I was reading USA Today last week, and there was a short article about a new law that's passed. It's amazing how we don't know what's going on. But this new law, in effect, gave the owners of the fields the decision on how often the workers can take a water break. And because, production goes down with the more breaks, and the breaks are based on how frequent and how long. There was one woman quoted stating that she doesn't drink too much water during the day because there's no bathroom within walking distance. So all this is going on. Maybe that's why they're not 100 for 100 openings. So there's all these workers just have to get some sympathy so that things are better, but there's no sympathy in the legislature. Florida has a large population of shift workers, as most states have. Generally, it's considered about 16% of the workers are shift workers. And these are fire, police, nursing, healthcare. About 32% of the shift workers work at night. These are the garbage haulers and office cleaners, such people like that. And there is such a thing as a second-hand shift worker. That's the roommate or the spouse that gets woken up, when one's coming and going. And shift workers are not having a healthy body. And it affects the immune system. They have a poor diet. Sleeping is not good, chronic sleepers. There's a woman firefighter that said, I thought when I became a firefighter, the risk was getting burned. I didn't realize it's a risk of getting breast cancer, which it is. It's interesting to search that, because it's amazing. It's like 20%. So shift workers, many are people without insurance. Some of the poor people cleaning hotel rooms at night and such things. So they need insurance, and that's a real problem for these poor people. Florida is one of the top 5 states with the worst statistics for vaccinations. I think we all have heard that. When COVID was around, it was a real circus because of this Surgeon General, Dr. Joseph Ladapo, who didn't believe in vaccines. And recently we had mussels coming into Florida and a few other states too. There were about 100 kids that developed measles, and about half of them were hospitalized, probably for more isolation than any treatment. But that's the problem. And but now it's getting a little more serious because of the HPV, the human papilloma virus. And that's become #1 sexually transmitted infection. I don't know if the disease switched to infection or not, but it's SDI. And worldwide, it's phenomenal how that's taken over. In the sub-Sahara countries in Africa, it's like around 30% of the population. And this infection can occur anytime, but the problem is it's related to 6 cancers. And the cancers show up around age 50 to 60, right in there. And 6 different types. And one type, which is the most common in male, is cancer of the head and neck. And of all the cancers, that's one not to get, because surgery is usually necessary and many end up very disfigured. Now it's interesting, and maybe you're aware of it, that the vaccine should be given to kids 11 to 13. And the 2 vaccines are given 6 months apart. But if a child is 14 to 15, they have to have a 3rd vaccine. And that's all because the immune system doesn't react as well as the age goes on. So it's not given to adults, except maybe there's a few situations they might try it. So you have to get it early, and you can't go back. Now with the anti-vaxxers, many in Florida, I wonder if they would know about it, if they would give it to the kids, if they would have the kids. But unfortunately, they're probably not reading anything about vaccines, and hopefully their pediatrician or physician would mention it. But You think, well, is that child abuse if they know about it and they don't give it? I don't know. I have to talk to the lawyers about that. And one final area I want to touch on, and we've heard about this today, is about the education system. Now, the best and brightest physicians moving in, they have families, and they've spent half their life in education, so they're looking for a great school system for their sons and daughters. And it doesn't seem like that's going to be very easy to find around here. And they want good teachers, they want a good library to read what they want to read, and just the common sense type of things. And it's going to be a problem. And it's going to be hard to do anything to change it. Now, the Republican Party is the only party that has a primary before it's in August. And then the national, or the Florida election, of course, will be in November. And on the ballot is a question, should the school board members be partisan? Now it's not partisan. Up until now, and hopefully in the future, for somebody running for the school board, you want somebody with good education, experience in education, good ideas, be creative. But if this passes, if all of them are partisan, then every school board member in Florida will be Republican, and they'll be able to decide on a policy, and there it is in Florida. The one way around it is the voters could change their party affiliation and vote in the Republican primary. Fill out a form. And then you can always switch back, or it really doesn't matter. You can still vote for who you want to vote for. So the question is whether we can get the best and the brightest physicians to man the HSS new facility or the Schultz clinic. And I don't know. I mean, there's so much negative about Florida medically, and then sprinkled with all these crazy policies going on. I don't know. Guess we'll have to see what happens.
You may have some questions addressed to you. Powerful presentations, timely presentations, important messages. So it's time for Q&A. Those that are here in the audience, raise your hand. For those of you who are virtual, hopefully you'll be able to find a button that says Q&A and type in your question. That hopefully will work for us, and we'll be able to relay it and ask your question right here. So individuals in the audience that have some questions of Dr. Arnold and her phenomenal presentation and her bravery to speak up and speak out in her national work and efforts, feel free to do so. And also, Dr. Diegel is happy if you want to talk about the challenge of education and the training right here in our own state. Thank you. We got some questions?
Mary Beth Boray, question for Kate. Thank you very much for your presentation. So much of what you talked about is so disturbing that it's hard to know kind of where to start. But thinking about the future of doctors taking care of women, how are we going to make up for the deficit in medical schools in red states where they're not learning anything about true reproductive health care?
The question was, how are we going to make up for this deficit for all these residents and medical students that are being trained in red states that are not going to get access to this abortion training? And I think that is a very difficult question. I almost included this. So when I was in medical school, you rotate through every specialty, and what sticks out in my mind is when I went through my psychiatry rotation, which I am definitely not meant to be a psychiatrist and did not really get good training. And so I I got good training eventually, just not in this patient's room, this poor guy. So I was being trained by this sweet, very soft-spoken man who was a priest. He was a priest and a psychiatrist, and I watched him do a couple consults in the hospital, and then he was like, "Well, do you want to take this one?" And I said, "Sure." And he said, "There's this guy, and he either fell or jumped off a bridge. He was on drugs, and we don't know if he fell or jumped off. And so the consult is to try to figure out, was this man suicidal or not?" Well, I'm definitely meant to be an OBGYN. We're a little bit more direct, and we just kind of say it. So I walked into this man's room and pretty much said exactly that. I just said, "I'm here because they can't tell if you jumped or fell or what happened. And, I understand you were on drugs, so it could be either one, but that's what I'm supposed to find out." And he was like, "No, I didn't jump. I fell. I was high. I don't want to die." And I turned around to see my poor preceptor just so disappointed and so flabbergasted that I had performed that way. Luckily the patient didn't mind, but I think about that when I think of these people are not going to have any training, and obviously that luckily turned out okay, but you need so much training. And the hard part is that there are a lot of pro-life OBGYNs, and I'm blanking on the organization's name. There's an organization that's pretty prominent that has organizations in Texas and then also around DC that's doctors who are very, very against any kind of counseling, any kind of abortion, and they're passionately not wanting to learn. And I still saw that in Oklahoma. There were still doctors who, were like, "Well, I'll come to Advocacy Day if it's about preventing domestic violence, but if it's about being pro-choice, then I'm not going to come." Or even people in leadership who said, "I'm not going to send my staff or my residents or I won't give anybody time off for it." So I don't have a good answer. I think it's a huge issue, and I think in order to learn to counsel women well, you have to want to do it. And I think we're losing the want part of it. I think if you want to learn it, you can. There's options. But if you don't want to learn it, that's back to the bigger topic of we're losing the importance of women's rights as a value. I think that might have been a more depressing answer even than your question, so I apologize. But I do think it comes back to the root of the issue of valuing that discussion.
Yes, my name is, can you hear me?
Yes.
My name is Gene Markham, and I wanted to just say thank you so much for coming to speak to us today and for the work that you've been doing.
Thank you.
I am a retired obstetrician gynecologist.
Hey, nice to meet you.
A grateful member of AARP. My monumental day was July 1st, 1970, when I started my OBGYN residency. And that was the very day that the abortion law went through in New York State.
Wow.
2 years before Roe. And I was faced with my first day of what's a D&C, what's a D&E, what's a saline, all these things. And we had people lined up in the hallway signing up for the voluntary abortion. None of us knew how to do that very well. We were very experienced with other types of abortion care. Mm-hmm. So that's how I got involved with it. And I spent my whole career before Dobbs. So I was very fortunate in that respect. Mm-hmm. After Dobbs, I just have to tell you, my heart is very heavy for my profession. Mm-hmm. I have a very good friend who was a police captain in New Jersey. And one day I asked him, I said, "Artie, I'm thinking about getting a bulletproof vest. Do you think I should get one that covers the front or the back?" And he said, "It depends on where you think you're going to be shot." Because I would go to the abortion clinic regularly, and I would always walk against the outside wall of the building. But I thought my chest was vulnerable. So I thought, I can't. Anyway, I just said, if I'm going to be shot, I'm going to be shot. And after I retired, moved to Florida, sunny Florida, I started to take a water aerobics class every morning. And I began to notice that when I would go in the swimming pool, 3 women would leave the pool because they wouldn't swim in a swimming pool with a physician who had performed abortions. So I have a very mixed attitude toward it in terms of my personal life. I know you have courage. I know I had courage. I think it's harder now, and I applaud you for what you've done. Thanks.
And to you. Thank you. Thank you. Hi.
I'm, among other things, an escort at Planned Parenthood, and we hear a lot from the protesters about the fake clinics. I wonder what your experience has been, what kind of experience you may have had with that, and if you have any strategies you might wish to share.
Well, thank you for doing the work that you do. That's incredibly important, being that patient advocate. It's scary. When I was in Oklahoma, it was again just illegal, even pre-Dobbs, for me to go participate in abortions. And so I actually, between jobs, between OU and my FQHC jobs, I went to an abortion clinic and got to see abortions again, and saw the protesters and saw the patients getting the services that they need, and can only imagine that an advocate being there would make it much of a nicer experience. So thank you for what you do. I think misinformation in general is a huge problem right now. We saw that with COVID. It got obviously terrible. We had to have like so many rules against ivermectin and everything. And so I think, again, these clinics are part of a larger issue of the truth being accordingly malleable, just depending on whatever the political priorities are. For those of you who aren't familiar with it, what we're talking about is clinics that oftentimes will act like they're going to give you all the options, and then they really just string you along until it's too late to get an abortion where you are, or just in general, or it's harder. The further you are in pregnancy, the more complicated an abortion is, both medically and surgically. We saw some of that in Oklahoma. We didn't see a lot of it, in all honesty. And I'm not sure why that is. I'm obviously very thankful that we didn't see as much of it.
Florida is heavily paying taxpayer money. Yes. They just added $25 million last year for being.
Oh, that is awful. Crisis pregnancy centers. Yeah, I honestly don't know what strategies there are. I think patient education is key, but then it's tough because, again, the issue that I didn't really bring up during the talk that I think is relevant to both these questions is there are a lot of OBGYNs who are pro-life and who are going to not want to be sure that their patients know which clinics to go to. So unfortunately, sometimes the OBGYNs who you would hope would advocate for the patients and make sure that they were in the right clinic may not be wanting to do so.
I'm sorry, I have one other, something else just came to me. I wrote a letter to one of the major federal health organizations in the last year because I was reading literature on their website, and it appeared to not be distinguishing fake from genuine clinics. I wish I could remember which one. And I never did get a reply to my letter. And I wonder if you know anything about that.
Like sites that list clinics that would be genuine versus not. I don't know. OBGYN or ACOG, ACOG does not have a list of those kinds of clinics. Now, ACOG, which is the American College of OBGYNs, American College of Obstetricians and Gynecologists, it's our national professional organization. They have had to start threatening to take away licenses, like professional licenses, not your medical license, but your professional certification, for people who are saying things that go against ACOG and perpetrating things that are not scientifically based. We started looking at doing that even from our medical board standpoint in Oklahoma. If you were, prescribing ivermectin and that kind of thing, that you could lose your state medical license. That would probably be a tougher sell from a state license in Florida, but ACOG may be an avenue to at least get OBGYNs to be in line with national policies. You're welcome.
Thank you. I wanted to first say that your presentation is a perfect example of why personal stories are so important in this. And I know that in the movement here, Yes on 4 for the amendment, they really encourage people to talk about their personal stories. And I want to thank you. Well, thank you. I also wanted to mention that in what Dr. Diegel talked about, he mentioned the upcoming primary being only for Republicans. There's some confusion there. The presidential primary we just had, in Florida we have 2 primaries. The presidential one was only for Republicans because there was no one running against Joe Biden in Florida. We have another one in August. Please, every one of you who are voters in Florida need to go and vote, and it has Democrats and Republicans. And so it's really important we show up. It'll include county commissioners, it'll include school board candidates, it'll include your city representatives, and it will include Democrats like Debbie Mukersel-Powell, who have competitors. So she's running against Rick Scott. So we need all of us to work to get everybody to vote in the primary that's coming up in August. So I thought that was an important distinction that we need to make before we leave here so nobody's confused. Thank you.
Great point.
And first of all, I want to thank both of you. I mean, you're really American heroes. Thank you.
Thank
you. I guess what I'd like to talk about, because it just drives me, I'm just trying to understand the big picture here. I mean, Maddie was just saying, when you're talking about all these decisions about medical decisions, I mean, what is this all about? I mean, I understand about white nationalism. I understand about concern about being replaced. But I just don't get all of this. I mean, what's going on here? I mean, we don't want the poor people in the field to have some water or go to the bathroom. We don't want to have poor people have medical care. We don't want children to be it used to be back in my day in Jersey, children had to be vaccinated before they could go to school, for heaven's sakes. So, here too? Oh, that's right. You had Democrats here at one time. No, but I mean, really, even Trump, what is going on? What is this big picture? What's happening to this society, this country? And a short answer, please.
You want me to fix it all too, right? Like explain it and then fix it? Yeah. I mean, I really think when you zoom out at that level, I think we're starting to view people who aren't rich white males as less than human. I mean, if you zoom out all the way, I think that's it. I also think that, abortion restrictions are in no way meant to be abortion restrictions for everyone. I think we all know that if somebody who's in power, if their family member needs an abortion, they're still going to be able to get an abortion. And so it's really restricting the people who can't do that. There's a lot of people from Planned Parenthood here, which is excellent. Colleen McNichols, who's she's CEO of Planned Parenthood. She's high up in Planned Parenthood. She's also high up in American College of Obstetricians and Gynecologists. She came to our District 7 meeting, which was like Oklahoma, all the way through like Alabama, Mississippi, and she came in and she said, we talked about how we couldn't do abortions in our states, and she was doing abortions, I think, in Ohio, and she just looked at all of us and said, I'm taking care of all of your patients. And it was a very powerful moment in the meeting because she literally said, I have calluses on my hands from doing so many abortions on your patients. And she said, they do everything in their power to get to a center for abortion, and we have had to enact just complete social services because they get there with their kids, with no child care, with no money, with no food, even needing clothes. And they've used all their resources to get there. They can't get home. They just knew that they had to put all their money and resources into getting that abortion. And doctors, I'm sure you can attest to this, doctors do not like being told that somebody else is having to take care of their patients. It's like, it's embarrassing, and it makes you feel like, gosh, like when you phrase it like that, that's terrible that I can't take care of my patients and that somebody else is working so hard to take care of my patients. So I think we have to recognize that abortion restrictions are only aimed at those who can't get the resources. It's not about maternal health, for sure.
I have a comment about the poor people. And Florida is a little unusual because there are a lot of very wealthy white males around. And I was in an organization and had a conversation with one of them. He sold his company, retired, came down here. Seemed like a nice fella until he started talking. And he, I think he feels like a lot of people down here feel, that they came from nothing, they work hard, they're successful, and they feel, the poor people, if they got off their couches and came out and worked, they can do it. I did it, they can do it. And why give them extra money? Why go out of your way to help them? They could do it if they wanted to. And I mentioned, well, many of the poor people, they might be vets with PTSD, disabled, mentally maybe not healthy, and they just can't do those things. And he just walked away, you know. I was not going to convince him about anything. But with that attitude in the society we live in, I think that explains a lot.
Hi, I'm Carrie Lerner, and I am running for Florida Congressional District 19 against Byron Donalds. Byron Donalds has signed on to the National Life Begins at Conception Act. He must be stopped. And we need, I would like to thank, before, you know, I don't want to, I'm a politician, you know, but I want to thank Dr. Arnold. There are so many points that you made that I share. I grew up in Lee County. I grew up in Florida. I love this area. This is my home. But I moved away for a lot of the isms, the racism, the sexism that I was very intimately familiar with. I raised my family in New Hampshire. But once my family was raised, I came home to serve. And so, you know, I understand that draw to home that you felt towards Oklahoma. And I also understand there are a lot of people after the last election and after Ian. I'm a realtor. I sold their houses for them. You know, a lot of our strongest advocates, a lot of really wonderful people gave up. They threw up their hands and left. But I think it's important that those of us that are here, that we not lose sight of the fact that the pendulum is swinging. We look at what's happened in other states, but what we need to do is, as you said, be welcoming to those, welcoming them back. We need to welcome people, stop calling people traitors and you know, oh, they're so dumb, they're ignorant. Even though, you know, we may really believe that. We need, in order to bring people to our perspective, we need to be welcoming. You know, and so that's a really an important part of what's happening. But I wanted to thank you for that, and thank you for the advocacy that you are doing, that you continue to do. Your entire life is advocacy, and we are so grateful for you. So thank you very much.
Thank you. I agree with you, and I think there has to be compassion for people who essentially got tricked. I mean, there's a lot of good people who have been tricked into the MAGA party and into Trump, and I think we have to have compassion. I mean, when you finally come out of that daze and realize what you've done, that must be a very humbling moment.
Dr. Arnold, this is a question from the internet, and they asked the question, are you traveling to other places and speaking on this topic, on this issue?
Yes. This is, as I said, I didn't feel safe to speak out when I was in Oklahoma, and so it has been very liberating and honestly part of the plan to be able to move and feel like, okay, my family's safe, I'm safe, and now I get to speak out like I had wanted to.
Hi, I'm Elena Reyes. I'm a psychologist, and I just retired from Florida State University College of Medicine down the street in Immokalee, where we serve a lot of poor patients. But one of the things that we keep talking about, the future and the brain drain, it is here. We cannot recruit. 12 years ago, I came down here because even though there's a lot of money in Southwest Florida, we're considered one of the HRSA areas of underserved for mental health. So we don't have enough psychologists, we don't have enough psychiatrists in this area. If you can afford cash, you can sometimes get one, but otherwise you don't have it. And we actually, together with Lee and with the Federally Qualified Health Center, did a great job, I think, of bringing primary care down here and bringing psychologists where they're needed in primary care to do a lot of prevention and a lot of care and a lot of women's health. And we can't recruit them anymore. With the exception of 2, everybody that we brought down here stayed. And last year, we could not fill a class of postdoctoral health psychology fellows because they got excited about the program at the American Psychological Association back in August, and it's an innovative program. They wanted to come, and then they would say, oh, wait, you're in Florida? I'm serious. We did not fill the class last year. And they're struggling this year. They've got some, but they're struggling. And we can't fill professor at the College of Medicine positions because they're leaving, because they have children that they're concerned about, or they're not coming and taking these positions. So this is not in the future. And then if you hear about money coming from the legislature for school mental health, I can tell you I was taking those calls from the local schools saying, Dr. Reyes, can you refer somebody to us? We've got this money from the state. Well, if you can't train them, no, I can't send them to you. And now we've got money that the legislature is giving for chaplains. I respect chaplains. I work hand in hand with chaplains. But I'm sorry, chaplains are not psychologists and don't have developmental training and just are not. So this is not the future. This is now. So please be aware that we are now in dire straits in terms of mental health, along with women's health and every other health in this state.
Thank you.
Okay, one more internet question. Can you comment about OBGYNs who are pro-life and against abortion care?
Yeah, I mean, to me, I think it's interesting because I think a lot of OBGYNs, in my experience, started out pro-life and with a little bit of the attitude you mentioned of, you know, my poor patients could just work harder or something like that. And then when you're in residency, generally you take care of Medicaid and uninsured patients, and you see every day the struggles of getting to a doctor's appointment where it's a residency clinic, so you're there for 2 to 3 hours because the med student sees you, then the intern sees you, then the intern talks to the chief talks to the attending, and eventually you get an answer. And all of that is with a bus and a bunch of kids. So generally, I feel like residency increases compassion towards a lot of the underserved populations. In terms of OBGYNs who are against abortion, in my mind, and actually this is just national policy also, you can be against abortion. You do not have to do abortions. That is not an expectation. You do need to be able to counsel and refer. And that's the same for like care of transgender patients, you have to be able to say, hey, what you need is X, Y, and Z. I don't provide that service. Here's somebody who does. And it has to be an actual clinic, not one of the fake ones. So I have no problem with pro-life OBGYNs, but they do need to be able to say, this is not a service I provide, and here's how you can get it.
Yes, hi. This question is for Dr. Diegel. My name is Julie Van Egmond, and most of the ladies at this table are friends with your wife.
That doesn't surprise me. I'm known as her husband, not Tim.
My question is, you referred to this need to recruit the excellent doctors that are out there. Do you have a thought or an idea about how to do that?
Well, that's a good question, and I don't really have a thought, because I think it's a big problem. And many, if they don't know much about Florida, then they'll probably come. But then it's the retention problem. They're going to stay. But I don't know. In these two large clinics, they're going to need a lot of top doctors, to maintain the reputation of the HSS and start the reputation of the Schultz clinic. And I don't know. I mean, someone very well trained in the medical field and surgical field, they can go anywhere in the country. The temperature is maybe a little nicer here, but that's not enough. That's not enough. So if you come up with any ideas, let me know and I'll pass it on.
Yes, my name is Arnold. I'm a retired physician. Now I'm doing consulting, but we used to talk about the poor that is lacking care or have lack of access, and that is completely true. But in Florida, we have a continuous financial and economic rationing for everybody. If you don't have, I see a lot of patients that have good access to care because they have insurance, but it's a financial rationing that is happening for all reasons that we're talking about. Lack of physicians and economic rationing. So we used to say, well, the poor are not getting care. That is true, but it's all of us. If you don't have a good coach as a patient with a good primary care physician, you are screwed up, literally. And the second question that I have for a friend of obstetrician is that we should have some data in terms of what's happening with these phase clinics that offer services for pregnant women. Because if 90% of the abortions are going to happen anyway, what happened with those patients in those clinics? Those individuals are going to get complicated, and those individuals have to be taken care of by somebody, or else we're having a mortality rate on those clinics somewhere. So the data should be somewhere on those clinics. So those clinics should be monitored for the patient that they see, because those patients are going to get the abortion no matter what, no matter how much you pray for it. Is that right?
I mean, the short answer is sometimes they're not going to get the abortion. I mean, sometimes they don't have the resources. There's a lot of stories of this in Texas of women who wanted abortions and weren't able to get it. The term for it is forced birth, that you weren't able to access an abortion, and so you have a baby. And so I absolutely agree with you that there should be repercussions and consequences. Unfortunately, sometimes when it's doing exactly what it's designed to do, it's tougher to get that.
Great. Thank you. I have a question. It's kind of a two-pronged one, but I feel like you're probably going to be able to put it together. So it has to do with the economics. Like, we've had to take certain topics, right, and put that economic angle in order to be able to bring people in, more moderate thinkers into understanding it from a different perspective, right? Because especially here in Florida, those arguments tend to be winning arguments that people can agree with without having a lot of discussion. So I'm wondering what sort of work is taking place to really look at the economics of how limiting abortions is affecting communities, people, state governments, federal governments, how much money people have in their pockets, and also the cost of having more children, the rates of disability increasing, how those are projected to also impact individuals, caregivers, teachers, resources that are providing going forward. What sort of work is happening to look at those angles to help create some reasoned arguments that folks can relate to who are on the fence? Thank you.
Yeah, you're welcome. I think that's a great question. The first statistic that I'm aware of that everyone's working really hard on is not economic, but is maternal mortality. So when we look at, those maps that always line up, looking at maternal mortality and then looking at abortion restrictions, maternal mortality is going up in areas where abortion is restricted. Part of that is because some women are wanting abortions because they know they're not healthy enough to be pregnant and to carry a baby. Being pregnant and carrying a baby is dangerous. And so some of them know, wait, I'm older, I have diabetes, I have high blood pressure, this might be a high risk situation, and they decide to terminate. Sometimes it is very sadly because of fear in the medical community. I, in Oklahoma, was on the maternal mortality review committee where we reviewed every maternal death that happened. And we started to see cases of doctors just being scared that something wasn't legal. And it was legal. They were just scared that it wasn't, and so they didn't administer treatment. One example that's not specific, but throughout the country, is looking at if somebody is pregnant with a baby with a heartbeat that's not viable yet, so you can't just deliver and save the baby. They're say 20 weeks. And the mom gets an infection, and she gets septic, which means that her organs start to fail because of this really bad infection. Well, that goes back to the question that we talked about a little bit of how sick do you have to be for it to be legal for me to induce this baby that is not going to survive. And we've seen deaths because of that. And so I think that's probably the first statistic, and maternal mortality rates are a big deal in terms of looking at quality of healthcare. And so I hope that will have an impact. I mean, it's literally people dying, so I hope that will have an impact. From an economic standpoint, I think that's going to be much harder to prove. I think some of the data that I've started to see is looking at of people who wanted an abortion, what % went and got an abortion. So in my clinic in Oklahoma, if I saw a patient and they said, I'm going to go, I couldn't give them resources, but they said, hey, I'm going to go out of state, I'm going to get an abortion. Or they might say, I'm on the fence, I don't know, I might get an abortion, I might not. For me, I always made those patients a 1-month follow-up, because I was like, if you had an abortion, then I can help you get birth control and make sure you're doing okay. If you didn't have an abortion, we'll continue your prenatal care, but either way, I'd love to see you in a month and see what we can do. So if you look at patients like that, at least in Oklahoma, again, I'm not as familiar with data outside, it looked like about 60% were not getting the abortions in a Medicaid population. So that is going to cost, a lot of money if you look at pregnancy care and then the baby being immediately enrolled in Medicaid, school, all those things. So I don't think we have any of the long-term data there, but I think you can extrapolate a little bit of it from patients who want an abortion but were unable to get it.
Let's thank our really special guest today.
Thank you all.
We're going to close out, but I'm sure that as you exit and have a little bit more camaraderie, you can ask some questions and share your perspective as well as your appreciation. I want to close out with just a couple of slides here. 2 months ago, just 2 months ago at the CPAC meeting, this guy here, Jack, how do you pronounce his last name anyway? He's letting people know exactly the game plan to basically take over democracy in this country. It's time to shut it down and create a whole new democracy, as he says. That was just 2 months ago, but 2 days ago he was back on presenting at the Hungary CPAC meeting, and along with Senator from and Carrie Lake speaking, and then hosted by Viktor Orban, who is now one of our American heroes, right? We want to live like Hungary, and Hungary and America should be just like Hungary is in terms of this autocratic direction. This is serious, folks. You all know it. You wouldn't even be here today if you didn't feel that way. And I want to use that as a lead-in because today's presentation with these two impressive physicians and their bravery and their ability to speak out, we have one coming next week. As I lead into that, this is a little quote here about your great-grandmother didn't fight for the right to vote. We want you to vote and to vote smart. We need to do that, and everybody needs to get that word out. Next month, on the 14th, we won't have this challenge of trying to link in-person and virtual at the same time. It will be 100% virtual, but we will have Dr. Scott Rivkus. Scott was the first Surgeon General with DeSantis and was there at the time of COVID, and they had a separation. For some weird reason, Dr. Rivkus wanted to follow science, research, medicine, and provide education. And our governor thought, nope, business was more important, even though we lost on a percentage basis among the worst lives and livelihoods in the state impacted in a negative fashion. So Dr. Rivkus will be our speaker. It'll be 100% virtual, and we're planning a tremendous program, and you need to get the word out and have more people participate. Hopefully we won't have the technological challenges that we had today, but we're honored by your presence either virtually, if you've hung in there with us out there when you've at least been able to get the voice, and for those of you who are here today in this audience. Again, Dr. Arnold, thank you so much for your impressive, brave presentation. Dr. Diegel, for sharing with us that people down here in Southwest Florida should be concerned about the viability of their future from an education, training, medical recruitment, and retention basis. Thanks, everybody. Have a great day.
My choice